Hi, my name is Lisa Sipple and this is my medication administration video. I'm going to start out by preparing the client's medication over at the medication cart. Before doing so, I would verify that the MAR sheet matches my doctor's orders. I would then move over to the cart. I would unlock the cart and I would remove the medication that I would need for this procedure. For today, I'm going to be grabbing Digoxin and insulin. I would also make sure that I have a syringe needle in order to insert the insulin, a little cup to put the Digoxin in, and then another cup for water for the patient to swallow the Digoxin. I'm going to be starting out the Digoxin. I'm going to verify that the Digoxin, I'm going to be starting out with the insulin. I'm going to verify that the insulin matches the MAR sheet for the name. I'm also going to make sure I verify the dose, the route, and the time that I will be administering the medication. I will also make sure that the medication is not expired. I would then inspect the bottle of insulin and make sure that it's not cloudy. If it was cloudy, I would roll it in between my hands. I would then take my syringe and I would put 30 units of air into the syringe because I will be removing 30 units of insulin from this bottle. I would then insert the 30 units of air into the bottle. I would invert the bottle and I would remove 30 units of insulin. I would then check the syringe and make sure that there are no air bubbles. If there were, I would remove them by flicking the syringe. I would then make sure that it says 30 units. I would also have another nurse verify that there are 30 units of insulin in this syringe. I would then label this syringe with the name of the medication that I have removed from the vial and the amount. I would then use the scooping method to recap the syringe. This would now be ready for administration. I will now be moving on to the Digoxin. Grabbing the Digoxin from the cart, I will make sure that it matches the name on the MAR sheet in the doctor's order. I will make sure that I verify the dose, route, and time I will be administering the medication, and I will make sure that it is not expired. I will now remove the Digoxin from the vial, and I will place it into the patient's cup. Everything is now ready for administration. Hi, Mrs. Annabelle. My name is Lisa. I'm going to be your nurse for this evening. Can you please state your name and date of birth for me? Perfect. Thank you so much. Mrs. Annabelle, do you have any allergies to over-the-counter drugs or prescription medications? No? Okay, perfect. Do you have any allergies to the environment? Okay, and then we do use a lot of latex here in our facility, so do you have any allergies to latex? Perfect. On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain that you've ever felt, how would you rate your pain right now? At a 0? Okay, perfect. Well, your doctor has ordered for me to give you insulin to balance your blood glucose and to give you Digoxin to help with your heart dysrhythmia. Do you have a preference of which medication I begin with? No? Okay, well then I'm going to go ahead and begin with the insulin. I would now be donning a pair of clean gloves. And I am using clean gloves, not sterile, because this is not a sterile technique. I would then ask if it would be okay if I if I removed the client sheet. So Mrs. Annabelle, I'm just gonna expose your left lower quadrant so that I can administer the insulin. I would then grab the insulin, I would uncap it. I would grab the most subcutaneous area, the area that has the most subcutaneous tissue on the client. I would warn her, Miss Annabelle, I'm now going to be inserting the needle. You are going to feel a little bit of a pinch, okay? I would then insert the needle at a 90-degree angle. I would remove my non-dominant hand and I would begin to insert the insulin. Once the insulin has been administered, I would remove the syringe at the same 90-degree angle, and I would apply a cotton ball with my non-dominant hand to the area. I would then dispose of the syringe recap the syringe and dispose of it into a sharps container. I would remove the cotton ball and I would inspect the area for any redness, bleeding, or reaction. None was noted. I can now remove the cotton ball and apply a bandage. I will then remove my gloves and perform hand hygiene. Mrs. Annabelle, after after administering the insulin, do you have any pain? Okay, perfect. I'm going to be moving on to the digoxin. I would then grab the little cup where I have the digoxin, and I would grab the cup of water. I would administer the digoxin and the water. I will then verbalize that the patient has swallowed the medication, and I will discard of the cups and perform hand hygiene. I will lower the bed to the lowest position and make sure that the bed is locked and that the railings are up. I will then give the patient the call light. Mrs. Annabelle, here is the call light. If you have any pain or any discomfort, please go ahead, feel free to ring the call light. Before I leave, do you have any questions for me? Okay, and then are you feeling any pain after the medication administration on a scale of 0 to 10? Okay, perfect. Well, I'm going to be back in about 15 minutes to check on you. Like I said, if you have any pain or any discomfort, or even if you have any questions, please feel free to ring that, okay? Okay, I will be back to see you soon, okay? Thank you so much for letting me administer your medication.